Welcome to Knowledgeable Aging. I'm your host, Jason Kotar. Joining us today to talk about sleep deprivation and pain is Robert Taylor. Robert Taylor is the CEO of Taylormade Sleep Services and Consulting. He has over 12 years experience in the field of sleep medicine. His passion for sleep therapy and education led him to start Taylormade Sleep. His belief was that patients deserve care that's more affordable, convenient, and specialized. It's not enough just to diagnose a patient, rather he wants to focus on the all-around health with proper sleep, nutrition, and proper mindset. How are you doing today, Robert?
I'm doing great, man. How are you?
Doing very good. Thank you. Looking forward. This is our second time together.
Mm-hmm.
So for those that are joining us for the live webinar, if you have any questions, I encourage you to type your questions, and time permitting, we will do everything in our power to get your questions answered. So I'd like to get started. Why is proper sleep so important to healing?
Oh, wow. That's a good question. You jumped right into it. I always like to paraphrase it with, I love, athletics and football and stuff like that. I compare it to treating your body as if you're an athlete, right? So athletes, they work out hard, they play, they play football. In order to heal, the thing they do throughout the week is get proper rest, proper quality, good sleep, good rest to heal the muscles, to regenerate tissues with the growth hormone, with testosterone, things of that nature, so that they can be ready to perform on Sundays. When they have injuries and things of that nature, what is always recommended? Stay off of it, get rest. Do this, get rest. Take this medication, get rest. At the end of the day, rest is always the most important aspect in anything. So to common people that don't play sports, or you have a normal job, you're an accountant, you're a nurse, you're this, you're that, you're a laborer, things of that nature. Proper rest is the same thing, to where if you have aches and pains, your body heals by getting good quality sleep. If you have a cold or the flu, your body heals by getting good proper sleep. It builds your immune system. We need to practice more self-care than anything, which I think is honestly the biggest issue in America, to where we literally just don't. I think we understand that sleep is absolutely important. I just think we toss it to the side because we're so focused on the job at hand, or oh, we got to push through, or you got to make money, or you got to do this, and next thing you know, you're in this whirlpool of doing the same thing over and over again. All the while, your sleep is absolutely suffering, and then you wonder, man, why am I always so sore? Or why am I always so tired? Or why can I not work out like I used to anymore? Or why can't I do all those other things like that? It's because you're always sleep deprived. RAM report reported that, and I don't quote me on it, but that companies lose about, I believe, billions of dollars every year due to lost wages, due to people that suffer from sleep deprivation, that are always calling in sick, or in pain, or going to the doctor, or just honestly come to work and not really there. Half the people function on autopilot, which basically means you're tired, you're fatigued, but you push through. So your brain kind of makes your body go because you have a purpose. However, you're doing it at half speed instead of doing it at your max. And we tend to honestly just function that way, and then wonder why we're having all these issues all of a sudden come up. Why are we not productive at work? Why is our marriage not where it needs to be? Why are these aches and pains now coming? Why is my diabetes now doing what it does? Why is my high blood? I can go on and on and on and on and on. I always say 300 aspects of your life is always affected by good quality sleep.
Now, we're going to get into the chronic pain aspect of sleep deprivation, but you know this, that it's not just the physical aspect, it's the mental, right? As far as what it can do to you mentally. And you talked about the lack of production at work, but it impacts you both physically and mentally.
Oh, definitely. The mental aspect of it is honestly way more important than the physical, because the mental aspect of it, it messes with your mind, to where, okay, before you can go, right? And then now it's like, God, I'm tired, I'm dreading work. There's so much work to be done, and yet it just seems like there's not enough hours in the day to do it. Whereas before, a few years ago, Like, huh, work, bring it on, bring it on. So what do you do in order to substitute that? Well, why do you think energy drinks, a surge in energy drinks, or 5-hour energy, or this pill can give you energy, or that pill can do this, and that pill can do that? We always mentally check in, but mentally we check out as far as like getting good quality sleep. And in turn, we turn to a quick fix instead of just asking ourselves the proper question, how are we really sleeping? Right?
Mhm.
Like when I tell people what I do for a living, one, they're always rude when they respond to me as though it's like, I sleep 8 hours, I'm good, blah, and they just push me away. And I'm just like, wow, that's really rude, that's mean. But what's the quality like? And then they pause for a second. I'm like, yeah, what's the quality of that 8 hours? Do you wake up feeling great, or do you wake up feeling like you can go back to sleep? Do you sleep all 8 hours, or are you up and down throughout the night? And then that's when the truth comes out to where, well, I toss and turn, I have back pain, I have this, I have that, and all of the stuff. I go to the restroom 2 or 3 times, blah, blah, blah. So you try to sleep 8 hours, but you really probably only get 3 to 4 hours. And if you throw sleep apnea into it, that 3 or 4 hours feels like 30 minutes, to be quite honest. But the stress that you put upon yourselves mentally from exhausting yourself mentally literally ruins every aspect of your life, as far as like increasing your blood pressure, uh, heart abnormalities, just things of that nature. And that stress piles up because if you're not productive at work, and if you're not doing this and this, if you're not doing that, due to the fact that you're tired, money comes into play. Exactly. So that's stress. Okay. The bills keep coming in. That's stress. This person got promoted and you didn't. That's stress. Like it just keeps going and going and going. And then you bring that home to where, well, there's no money, can't go out, can't take the wife out. The wife likes going out. Like it snowballs. So mentally, yeah, the mental mindset of getting good proper sleep is so important because it aids the physical. Mentally, if mentally you're checked in, you can honestly do anything.
Yeah. So help me out with what exactly is sleep deprived? What does that mean?
Well, that basically means you're tired all the time.
Okay.
A lot of people have bags under their eyes. You can look at NFL coaches, basketball coaches. You can even look at players and things of that nature. Doctors are the worst. Doctors are the worst at it too because they have the craziest shift. Some people have shift work disorder, that they work nights and then sometimes they work days and things of that nature. Being sleep deprived isn't going off of the quantity of sleep, it's going off of the quality. How you feel when you sleep, right? So when you wake up, do you feel like you're ready to take on the world, or do you need to drink 4 or 5 cups of coffee to actually jumpstart your engine and get going? And then by 3 o'clock, you're tired and ready to go back to sleep, or you need a nap, or you need this, or you need that. That's a good indication that you're actually sleep deprived. Um, your memory's a little bit foggy. Again, your habits up slow. You're not healing properly. That's a huge key right there. Like if you had a sprained ankle, and sprained ankles, depending on severity, can last. If anybody's had a sprained ankle, those things sometimes take some time to heal, but it shouldn't take years. In some cases, some people literally have sprains, bruises, and things of that nature for months at a time due to the fact that they're not healing properly, due to the fact that they're not sleeping properly. You can even go into surgery, the surgery aspect of it, to where, say you're having back surgery or you have knee surgery, any type of surgery, the timetable they give you to heal is based on the fact that you're getting good quality sleep.
Mhm.
The medications that they give you is based on the fact that you're getting good quality sleep. So if you're not getting good quality sleep, that medication is going to run out, that pain's going to kick in, rehab's pushed back. What's going to happen, right? They may not give you any more medication. You're going to have to deal with that pain on your own. Rehab still has to be done. You're not going to fully heal. And then that causes more complications down the line to where you may actually need another surgery to repair the damage that you've done from the previous one.
So Robert, I assume it's safe to say
Mhm.
that sleep deprivation presents itself differently in individuals. It's not the same across the board. Are there stages to sleep deprivation?
Yeah, I would say yeah. Not everyone will feel it. So exactly, I'm glad you brought that up. A lot of people are on autopilot to where mentally they're just solid, they're strong. They wake up, they have purpose, they go, 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 go. Perfect example of that would be farmers. Farmers get up, crack of dawn, they got crops out there, they know what they have to do, they're very regimented. If anybody knows a farmer and has done it with them before, very regimented, programmed, boom, 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 boom. Those type of people, and police officers, firefighters, doctors, you name it, anybody that's regimented, you automatically have purpose. Whether you're tired, sick, sore, or in pain, you're going to get up at a certain time. You're going to go to work. You're going to do what you need to do. You're going to go to sleep. Here's where it gets interesting, though. The way we find out is we ask them the questions, and then all of a sudden they just say, yeah, I can fall asleep easily. I can fall asleep anywhere, honestly. And then you go into more detail. Could you take naps during the day? I know you don't take naps due to the fact that you're so busy, but could you? And then the answer is, well, yeah, I could sleep anywhere at any time if I could. Okay, now you're starting to understand that it's actually presenting itself. So it's all about honestly asking the right questions. Not everybody's going to come to you and to basically say, I'm tired all the time. I feel like I can't function. I feel like I can't work. I can't do this, can't do that. There are some that function perfectly fine, work perfectly fine, do all these things perfectly fine. But when you dig a little bit deeper, they go to sleep really, really easy. They wake up, they may not say that, okay, yeah, I feel rested, ready to go. Like I get up perfectly fine. Hmm, that's not what I asked. How do you feel when you wake up? Are you a little foggy? Are you hazy or this and that? You know, so you have to kind of lead them in the right direction. We're not always asking the right questions. We take one answer, it's like, okay, they're perfectly fine. But then when you evaluate them and test them, you realize you have probably suffered from sleep apnea for years, right? When you do that, your body adapts and finds a new normal. You've gotten so used to being so tired, you don't even know what the other half feels like. So you just go, 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 go. That's it. But that doesn't absolve the fact that you're suffering from sleep deprivation and you just don't know it. That's why it's always good for people to be evaluated. It's always good for people to be tested because you just don't know. You never know. And it's just always good to cross the T's and dot the I's.
Yeah. So let's move forward, Robert, and talk about the connection between sleep deprivation and pain,
Mhm.
chronic pain.
Right. So pain management is an interesting field. I spoke to a doctor once a long time ago, and what she said was, it's hard. It's a hard field because it's subjective. You can't tell how much pain this person's in. They can tell you. So while you may have a higher pain tolerance than this patient at pain tolerance 1 may feel that it's at 10, while this person might not think it's anything. And that's what makes the profession so hard. But generally speaking, if you're in chronic pain, your sleep is affected. And then vice versa. If your sleep is inadequate, you're in pain. It's a double-edged sword. 50 million Americans every year that suffer from chronic pain have a sleep issue. Half of them complain about insomnia, half of them have sleep apnea, half of them, the architecture, the rhythm is just completely off. They get in bed at a certain time. Due to back pain, they roll this way. Oh man, now they have shoulder pain, they roll this way. And next thing you know, they're in bed for 8 hours just tossing and turning the entire time. So not only are you not getting a good depth of sleep, but I'm positive that the quality is not where it's at. And these patients turn to medications to aid them in sleep. And this is where the problem really lies, is because Tylenol PM for a pain patient isn't going to work, right? Because they're so used to being on harder narcotics, opioids, and things of that nature. But what they don't realize is that those pain medications, if they have apnea, it slows down their brain's reaction time, right? So when you go into the deeper levels of sleep, your muscles relax. That's how they heal, right? Well, your muscle palate the muscle that holds your tongue in place is a muscle as well. So if it relaxes your body, it also will relax that. And in turn, in a lot of cases, your airway closes. But instead of reacting to it fast, like your brain normally would, if it's off medication, since you're on medication, the reaction time is slower. So if a patient has apnea, and apnea has to last at least a minimum of 10 seconds, okay? I have seen patients that don't breathe for a minute and a half and do not know it because their brains are not able to react fast enough. You can only imagine the effects that that's having on their heart, on their blood sugar, on testosterone, on their hormones, you name it, but also too on the way their body heals. The quality of the sleep is not there. You're not getting good depth because when you go into deeper sleep and these events present themselves more, your brain, as a defense mechanism, kicks you out of it and puts you right back in light sleep because you can't breathe in stage 3 in REM sleep. Therefore, you can't heal. So it's a double-edged sword. Sometimes you have to figure out which one comes first, the chicken or the egg, right?
Yep.
Is sleep deprivation causing the exacerbation of pain, or is pain causing the sleep deprivation? Regardless, you should be screened regardless and evaluated to see, okay, the quality of your sleep. Because obviously, if you're going to be in pain, you're not going to get good quality sleep. But you have to fix something, okay? Because you can't just keep pumping patients with drugs and expect this to be okay, especially if those drugs are relaxing them enough towards causing them to have more apnea, which in turn affects the pain. They may sleep through the night, but they're going to wake up still hurting, still having complications. Bones aren't healing, muscles aren't healing, bruises aren't healing, and still need more medication. So it's always good to just try to figure out which one is exasperating which. But at some point, you have to focus on the sleep. At some point.
Yeah. I want to stay with chronic pain for a second, Robert. You mentioned back pain or shoulder pain. Is there a certain type of pain that is most associated with the term chronic pain, like back pain?
Back pain, arthritis, neck pain, shoulder pain, fibromyalgia, diabetic nerve pain, muscle soreness, and headaches. Headaches and migraines are associated with it too. But those are the major ones. Back pain, I think, is really, really common. A lot of people don't necessarily realize they have fibromyalgia when everything is just sensitive to the touch, to where just everything is heightened a little bit. Your knee hurts, this hurts. A small muscle bruise or muscle soreness now is exacerbated to where everything's affected. Diabetic nerve pain is really, really serious. And it mainly comes from the fact that, one, they're not sleeping well and they're always up moving around. They're always up walking around, they're on their feet, they're constantly eating, they're constantly doing something instead of resting their body. So those are honestly the most common ones. The back pain, you're always going to toss and turn. You may sleep on one side for a little bit, and then all of a sudden it starts kicking in. You got to sleep on the other side. Tossing and turning, tossing and turning. Arthritis is just really irritating. Like places that have arthritis is just, they're shaking their hands in the middle of the night and things of that nature. They tend to occasionally get okay sleep as far as like depth goes, but it all depends on severity.
So you mentioned sleep apnea. What role does sleep apnea play when it comes to, you touched on it briefly, Robert, but what role does sleep apnea play with your sleep deprivation and the chronic pain?
Wow, wow, you are good today with these questions. So, okay, how do you get quality sleep? Hours and good, the quantity and the quality matters. With sleep apnea, a lot of people don't realize that there's more than just one type. But also too, a lot of people have to understand 10 seconds is a long time to not breathe. If anyone watches MMA, Ultimate Fighter, UFC, things of that nature, it takes them literally 4 or 5 seconds to choke someone out and the ref stops the fight. You're talking about literally being choked out for 10 seconds at a time, okay? So if that's happening in the deeper levels of sleep, you're not going to get that volume of it. Your brain is going to kick you out to save your life. Your brain also makes you open your mouth. Your brain also makes you turn left and turn right to try to aid you in breathing. If you have severe apnea, meaning even in the lighter stages of sleep, you're not breathing properly, your brain and your body are in overdrive and you're stressing yourself out more in your sleep than you are when you are awake which is absolutely crazy to think about. Your blood pressure can never regulate because you're stressed out more at night than you are during the day. But your brain is also always going. Your body's always going. So if you're working all day during the day and you go home and work in your sleep twice as hard, do you seriously think you're going to wake up feeling refreshed? Do you seriously think that that's a good lifestyle, that's good quality sleep? It isn't. But a lot of people need to understand that just because an apnea lasts 10 seconds, that's not how long maximum they can last. And again, I've seen people not breathe for a minute and a half and have no idea that that's actually going on. It always takes something major to happen for someone to pay attention to it, which is heart attack, a stroke, brain bleed, or just driving and falling asleep at the wheel just because you're just that tired. It's always something major. When we can do small things now to prevent that, it's just tossed to us, oh, I'll get to it later, because you don't think it's all that important. But if you realize for a second that this is a slow killer, it really is. When people are diagnosed with cancer, oh God, you freak out. And it doesn't matter how much it costs, it doesn't matter where you have to go. You associate cancer with death, you're going to do anything and everything there is to do to get better from it, because cancer kills fast. I get that. Sleep apnea kills you as well. It's just methodical, very slow. Oh, okay, now you have diabetes. Okay, you got to get that. Now you have high blood pressure. Now you have heart abnormalities. Now you have cardiac disease. Now you have a heart attack. Now you have a stroke. And it just keeps going and going and going until at some point, everything just shuts down. It's just so important to not overlook the importance of quality sleep. And it's so important to understand that apnea 9 times out of 10 is always the root cause of sleep deprivation.
Is it safe to say that just aging and sleep apnea go hand in hand, or are there other roots to the problem, like maybe you're overweight or just the stress? In other words, are you seeing it now that we're just more of an aging society?
It's a bit of both, to be quite
Okay.
honest. Gradually, as you get older, muscles deteriorate. So that's normal. However, kids have sleep apnea. That's why they have tonsillectomies. They take their tonsils out, things of that nature.
Got it.
Obesity, yeah, definitely does play a part, but it's not the end all be all to basically sit there and say that this is the cause of it. It's not proven, but generally speaking, every patient I see, they have a dad that's had it, grandpa that's had it, grandma that's had it, a brother that's had it, somebody else in their family has had it, and it just goes down the line. They don't say it's hereditary yet, but it kind of does run in the family a little bit. The perfect sign of things to come is the fact that you're snoring, right? Snoring, as everybody knows, if you follow me on Instagram or even on my website, snoring isn't sexy. I have to say that it is not sexy and it is not normal. It's a sign and symptom that you have other issues going on with you. It's a sign that you have a weak muscle palate because that muscle is shaking and wiggling, which is why you snore. So I've had patients that say the same thing. "Oh, I don't think I have sleep apnea. I'm not fat." I'm like, really? Neither was a football player I tested a couple of weeks ago who had about, 10% body fat. He's in 10 times better shape than you, yet he had it as well. I've had triathletes that actually have been tested and have it. It's an equal opportunity issue. It's not just limited to obesity. It's not just limited to diabetes. It's not just limited to elderly. It can affect anyone and everyone. Again, infants have this, which is why they do a tongue tie procedure, lip procedure, you name it, you can go down the list. As they get older, tonsillectomies, you name it. But there are always these surgical issues when you're young to get rid of it. But at some point when you're older, yeah, it's gonna bite you in the butt. Hell, I have sleep apnea. And I tested my own product, funny, and I would always test myself every year. I wanted to make sure my weight's good, this and that, things of that nature, and kind of found out, yes, one year my girlfriend said I snored. I was like, oh, good, I guess it's time to get tested anyway. Sure enough, yes, I have sleep apnea, and I don't know if people can tell, I'm not fat. I'm in decent shape. but it just happens. Sometimes it happens with time. Sometimes you just have it immediately. Sometimes people's muscle palate is just weak. Sometimes people have really, really big necks. Sometimes people are just obese. But again, it's much like diabetes, high blood pressure, low T, whatever. It's an equal opportunity issue, and everybody can get it. So,
Clarify for me, Robert, did you say that there are different stages of sleep apnea?
there are different types.
Types.
Yeah. So, but there, I mean, as far as like when you get diagnosed, mild, moderate, severe,
Okay.
right? So mild's 5 to 15 events per hour. Okay. So every hour of sleep, you stop breathing or you have an apnea 5 to 15 times. Moderate's 15 to, I believe, 24, and severe is 24 and above. I've seen people have an AHI of 70 to 80. Think about that. 70 to 80 times an hour, you're not breathing properly. Each event has to last at least a minimum of 10 seconds. That is crazy to think about, right?
Yep.
Like if I can put holy you know what on an interpreter to say that they have apnea that severe, that's bad. And a lot of people walk around like zombies and have no idea that it's happening. But you have obstructive, you have central, you have mixed, you have complex, you have parasomnias, you have hypopneas, and it all leads to narcolepsy, epilepsy, insomnia, you name it. But it always starts right here. How are you sleeping?
So can sleep apnea be cured?
Yeah, yes, it can. The treatment options these days have come an awful long way to where it used to be you have to wear a mask. And that's always everybody, yeah, that's always everybody, I don't want to be tested or this and that because I don't want to wear a mask. Now, thank God, we can sit there and say, how do you know you need to? Right? There's all kinds of alternative therapies from mild to moderate. Now, obviously, if it's severe, you have to wear a mask. I'm sorry. There's there's nothing that's going to get the job done on severe than wearing a mask. However, you can always come off of it, and that's what a lot of people don't realize. Wear the mask. If your BMI is well above where it needs to be, lose weight, be retested, see where your levels at. If your levels go down, continue to wear a mask until you get those levels down to mild to moderate. Then at that point, you can get on a different type of treatment options. But there's AutoPAP, which we always recommend, which is the grade A standard in my opinion. Excite OSA, which was FDA approved not too long ago, which I actually use, mind you, is a great treatment option for patients that have mild, slightly moderate. You have to evaluate that, and snoring. It's just amazing how this works. It's basically a muscle stimulator for your muscle palate. So it's a 20-minute workout a day to restructure and re-strengthen your tongue. It kind of works the same way as Inspire, except Inspire is a surgical procedure where they put the device in you and run a line to your muscle palate, and you press a button and it sends a small shock to it to hold it in place, to make it stronger. Two different concepts. One, Inspire will literally help any and all apnea. I mean, especially obstructive. But Excite for mild, you have snore lays where they just basically tighten up your muscle area, things of that nature. That's definitely for mild. Getting your tonsils out always helps. Losing weight helps. I mean, you have options, right? So don't let I don't want to wear a mask be the reason that you don't get evaluated and tested. How do you know you need to? We're a concierge service. So we like to give our patients every option known to man. And what we do as well, whatever option you pick, you still have these other options good for an entire year, right? So if you pick AutoPAP, 3 months into it, oh God, it's hard for me to adjust. I can't do it. Okay, well, judging by your diagnosis, you qualify for this, and this as well. What other thing do you think you would be interested in trying? Would you like to try an MRD? Would you like to try Excite? Would you like to try Inspire? And God bless it, we have built a proper network to where we can funnel patients to every specialist that can actually do that to assist them. So 56% of people fall off of PAP therapy every year. So you have to think about that too. If millions of people get tested every year and diagnosed, those millions get on PAP therapy. 56% of them fall off of it. What do you do after that? And that's honestly why I wanted to start my own company. It's because those 56 million or 56% need extra attention. But also too, 26 million people go untreated and undiagnosed every year. Those need to be addressed too. We have well, I wouldn't say millions, thousands of labs, millions of doctors, but yet 26 million people go undiagnosed every year. There has to be a change somewhere. We have to offer them more. I'm always looking on LinkedIn. I'm always reaching out to other vendors on treatment options. How does this work? Can you send me the data? Can I come see exactly how it works? Everything that we recommend, I've actually seen performed and actually seen data and actually seen real life results from patients prior to me even adding it to what we would even prescribe. So if we don't put our stamp on it and prescribe it, it's probably not something that I feel is viable. Of course, if anybody has other treatment options and you want me to come take a look at it, by all means, look me up on LinkedIn and let me know, send me information. I'll fly wherever you are and actually see your product. And if it actually does help, yeah, we would love to actually recommend it. But giving patients more on the menu only makes them want to be tested more. It makes them want to come to your restaurant. I could try the hamburger today, or the fish, or the steak, or this, versus we serve hamburgers and that's it. Chicken sandwiches? No, we don't do that here, just hamburgers. So we just like to gradually, as time goes, we want to grow as well with the need to where, wow, central sleep apnea is a bit more popular. Is there a better cure for that? Is there a better this for that? Is there something for hypopneas? Is there something that they're doing with narcolepsy and things of that nature? We want to always be at the forefront of it and kind of lead the charge to give it to the patients, to give it to underserved communities, to give it to the physicians to use it as an asset to help their patients.
If somebody reads sleep hygiene, dental hygiene, what does that mean?
Repetition and habit.
Okay.
What are you doing? What are you doing to sleep proper, right? So
Yep.
Your hygiene, if you're trying to be in bed by 10 o'clock, that doesn't mean you work all the way till 9:45, shower, then jump in bed. That means you shut down 3 hours prior and prep for sleep. So you train your body and train your mind to easily fall asleep when you're in bed. So perfect example, when you get off work, you eat dinner. Half the people after they get off work and eat dinner, they're on their phones, they're watching TV, they're on a laptop. The blue light tricks your brain into thinking it's still daytime. So it won't release the melatonin needed to actually aid you into sleep. So that's your problem there. And then what you do right after that, you try to take a quick shower, jump in bed. Meanwhile, your brain's still going because you just looked at your phone, you just got off work. So now you're thinking about it, literally anything and everything. And then when you're in bed, if you're not falling asleep in 15 minutes, you know what everyone does? Oh God, golly, it's this time. I have to be up in 4 or 5 hours. Now you're stressing yourself out even more. And then 20 minutes go by again. You look at your phone again. You look at the clock, this and that. Your hygiene, repetition, and habit. If you're trying to go to bed at 9 or 10 o'clock, what you do 2 to 3 hours prior to bed matters. What you eat matters. Do not eat something big and greasy and hefty and all that other good stuff like that. Eat something light, something easy to digest so your body's not overworking itself while you're sleeping. Take a nice long shower to actually relax. Use that shower to think about all the thoughts and everything that's stressing you out. It's my way of basically saying, wash it clean, wash it off, and just prepare for the next day. Because there's nothing you could do at that point at 10 o'clock at night. What are you going to do? Seriously, you're going to call somebody, text somebody, this and that. Look, hey, leave it alone. All right, it'll be there tomorrow. So whatever stresses you, whatever work you couldn't get over, this and that, when you bathe or you shower, do not come out until you're relieved of it. But also too, dim lighting helps. What your linen smells like helps. What your bedroom looks like helps. These are all things that when you go to like a hotel or something like that, right? When you walk into a hotel, a really, really good one, the bed's nice and made, the pillows are fluffed and things of that nature. The first thing you're thinking about, well, the first thing I think about is, oh man, that's going to be a good bed to sleep in. You're automatically triggering it. But if you come home and your house isn't in order, right? You got dirty drawers here, toys there, and it's a dirty house and your room is no better. That only adds to mental stress, right? And that only ruins hygiene. So become a creature of habit. If you like your room to be clean, make sure you clean it before you leave. If you need to take a good shower, this and that, get certain smells that actually aid in sleep. Lavender, again, fresh linen for me is just the key. If you sleep better when it rains, like when thunderstorms happen, it's like, I feel like sleeping. Great, get a sound machine that makes it rain. Make sure the temperature is where it needs to be at. Don't have it above 70, 72 or 73 degrees. You want to be cold, because if you're cold, you're not going to move when you find a nice comfortable spot in your bed. It tricks you. It's like, ooh, so comfortable. And then gradually you let yourself you let yourself go a little bit. So your hygiene is all about repetition and habit, doing something all the time, every time, making it a part of your daily life, and your body and your brain will follow suit all the time.
Really good, man. Love having you on, my friend.
Thank you.
How can people find you?
Well, I tell you what, you can always just check me out on Knowledgeable Aging if he ever has me on again. You never know. Or you can go to my website, taylormadesleep.com. We always do free, I stress, free evaluations. We do free 15-minute evaluations for questions about your hygiene, questions about pain, questions about if you snore, questions about if you think you need to have a sleep study. We are your one-stop shop. We are your one source. You do not need to go to a physician to be tested, treated, and diagnosed. We create our own referrals. I employ board certified physicians. We do everything in-house in the comfort of your own home. So you don't have an excuse, really. You don't have to go to a doctor. I can evaluate you while you're driving. So you can check us out on taylormadesleep.com, or you can email me easily, taylormadesleepservices@yahoo.com. Again, information is always free. We would love to help. If you need a study done, if you need to be evaluated, if you're miserable and need to be treated, please, by all means, let us help. That is why I started this company.
Very good. Thank you again, Taylor. Excuse me,
problem.
Robert, I apologize. As far as Knowledgeable Aging, you can go to our website, knowledgeableaging.com. You can find all of our upcoming and live webinars. I encourage you to go to YouTube, type in Knowledgeable Aging and subscribe. We update that 4 to 5 times per week. If podcasts are your thing, you can find us on Apple Tunes, Spotify, etc. Till next time, I'm your host, Jason Kotar, and this is Knowledgeable Aging.